Your ankle is where your foot connects to your leg. It is made up of bones, ligaments, tendons, and cartilage that work together to help your ankle move smoothly. The ankle works like a hinge, allowing your foot to move up and down when you walk. If you have ongoing ankle pain, it may be because the cartilage has worn away or the bones have become damaged. This is most often caused by ankle arthritis. If medicines, physical therapy, braces, or other non-surgical treatments no longer help, your doctor may recommend total ankle replacement surgery. During the surgery, the surgeon first exposes the ankle joint. Special alignment guides are used to make sure the bone cuts are accurate. The damaged parts of the tibia and the talus are carefully removed. Next, the surgeon prepares the bones for the artificial implants. The talus is prepared first by drilling 2 small holes to hold the implant securely. Then, the tibia is prepared by making 4 small holes for its implant. Once the bones are ready, the tibial implant is placed into position and secured with bone cement. After that, a polyethylene insert is placed between the metal implants. This smooth plastic piece acts like healthy cartilage, helping the ankle move naturally. Finally, the surgeon checks the ankle's range of motion to make sure everything moves properly. The incision is then closed with stitches, and the foot is placed in a cast to protect the ankle while it heals.